Right, so this is the third video in the series about ethics and terminal weaning. So terminal weaning, the definition I saw was that it's a clinical procedure that involves gradually reducing mechanical ventilation support for a patient when it becomes an unacceptable outcome, meaning that they've gotten to a course where they're not going to get better or have a real quality of life. So you start to slowly, incrementally take down the mechanical support to assist in the patient to pass away and give medicines and medications to make that a comfortable passing. Two methods of terminal weaning is just that, terminal weaning, turning down mechanical ventilation settings gradually. So you could reduce the FiO2 or reduce their rate or pressure support to help slowly and gradually help them pass. And then another one is immediate extubation. So completely withdrawing from mechanical ventilation to either room air or maybe on a low amount of supplemental oxygen, a nasal cannula with a bubble humidifier. So life support withdrawal can create an ethical dilemma for respiratory therapists. Our role as a respiratory therapist is to provide the patient's ventilatory care and oxygenation at all cost. And the principle of non-malfeasance says that we will not do any harm or to our patients. And terminally weaning or extubating kind of goes against that because we are like maybe they're not getting better or going to have much of a quality of life, but you're essentially letting them die, which is against what we really all kind of stand for. So I could see how that could cause people to have a bit of a ethical dilemma because my job's not to be the Grim Reaper and pull the tube and let them just pass, or in other people's opinions, maybe it is. Maybe that is somebody's place. But I could see how that could cause a dilemma with people. And recommendations for people who are having that kind of dilemma with themselves or has angst against the ethics of terminal weaning, I would say for me personally, I would want to be respectful of them and how they feel, and let them know that I'm there in any way that I can help. For just someone to speak to about it, or I don't have to always give my opinion because mine would differ. I do believe that I'm there. Somebody has to do that, and I think that's part of my job, and I should be able to do that, but I understand why people could feel differently, and I respect that. We all have different backgrounds and different pathways that led us here. So who am I to say what they should or should not feel? I would also say therapy is always a good thing. I think it's good for our profession or anybody in the medical field to take therapy, or even in general life. I think therapy is a good thing. So if they're comfortable with that, find someone to talk to professionally. And if you're a religious person, I would say, you pray about it. You pray about it and look to a higher power to give you ease or make you feel more comfortable about it, or to give you a definitive answer that I'm not the person to do that. But first and foremost, for me, my recommendation to any other therapist that's around somebody that's feeling those ways is just to be supportive. Like I said, we're all different folks, different strokes, different pathways that led our lives to what we've become and where we are. Just be respectful and respect their feelings and try to be helpful as much as you can. And so that pretty much wraps up the last video in this series. My name's Nick Riesenberg. It's fun and it's been good to do these videos, but I have to say it's a good feeling to know this is the last one. Thank you very much.